health, several of the laws taking effect this week will begin actually rolling out in the new school year with the goal of keeping our children healthier and safer. They address anything from life-threatening medical conditions to emergency responses. Here's what I found out. As summer is well underway, it can be tough to look ahead to the school year. But when students return in August, subtle changes will be in effect, beginning with responses to food allergies. Right now, doctors say you will find roughly 2 children in every classroom who has a food allergy. A new Florida law will mandate schools to have an emergency action plan for anaphylaxis for students in kindergarten through 8th grade. This would require education, training, and administering epinephrine in case of a severe allergic reaction on campus. More than 33 million people in our country have a food allergy. It's a topic the NBC6 Response series, The Silent Threat, covered extensively for months, as parents and experts have been pushing for more uniform guidelines and school policies. FAIR, Food Allergy Research and Education, is a national nonprofit who advocates for those affected. Its medical director, Dr. Kelly Cleary, says this new law essentially sets a baseline for school districts.
The way that anaphylaxis and food allergy is managed in schools really varies from school to school. So some schools are doing this, really well, and they've got policies, procedures in place, and other schools don't. So what this law really does is standardize that.
Dr. Cleary says data shows 25% of the time epinephrine, or EpiPen, is administered in schools, the person didn't know they had an allergy, so recognizing the signs and symptoms is critical. Next up is another law which helps manage diabetes in schools. House Bill 597 allows schools to acquire and store glucagon in case a child with diabetes has a blood sugar emergency. Included in the more than 200 new laws approved this year, Senate Bill 1070, or otherwise known as the Second Chance Act. This one requires electrocardiogram assessments, or EKGs, for student athletes before they can participate in a school sport. Florida is the first state in the country to require this screening. The goal to catch undetected heart conditions and prevent tragedies. This will be enforced starting in 2026, but schools in Miami-Dade will start this year. And I spoke to Miami-Dade and Broward Public Schools, and they confirmed that students with diabetes are currently managed by a nurse who follows an action plan. The school also provides a child-specific training for staff when it comes to allergies. Broward Schools detailed to us their training and said that they will continue to monitor state guidance and collaborate with healthcare partners to really fully comply with any of these new laws.